Therapists who work with some of our most vulnerable children are asking, where's the money? They say in the months since North Carolina transitioned its Medicaid program to a new managed care approach, the 5 private companies now in charge are dragging their feet, paying them, denying 1 out of every 10 claims. And now there's fear that some low-income kids won't get the critical treatment they need as a result. A top state official told Nate Morabito what he uncovered is unacceptable and promised action.
Some small healthcare businesses have waited at length to get paid for services they provided 4 weeks ago. For those struggling to keep their doors open, Medicaid's deputy director told us North Carolina will step in and cover their costs while they wait to get reimbursed.
It's been 29 days. Our patience is kind of wearing thin at this point.
The amount varies from Salisbury
I'm waiting on over $5,000 right now.
to South Charlotte
We are in the hole for $9,000.
to Concord.
About 35,000, and that number just keeps growing.
Each dollar represents speech and occupational therapy provided to a child who desperately needs it.
It is very frustrating, and our patients will definitely pay the price because there are some practices who are going under or who are putting, kids on hold from services.
Take speech language pathologist Tara Puma.
I am looking at putting those children on hold for services until we can get reimbursed for them.
What a decision to have to make.
Yeah, it's really hard because these are North Carolina's most vulnerable population.
Her small in-home therapy business has already struggled to survive the pandemic. Now she's trying to overcome a major Medicaid change at the state level.
They definitely seem ill-prepared.
North Carolina officially switched to managed care on July 1st, which means the state handed over control of its 1.5 million patient Medicaid program to 5 private companies.
This is one of our occupational therapy gyms.
A move years in the making.
These things should have been figured out before July 1, 2021.
These small business owners can't understand
There hasn't been clear and consistent guidance.
why they're encountering so many problems.
We need some hardcore problem solving because we're just not getting that. We're just getting lip service.
It's been a month. They've not received payments.
How is that acceptable?
It's not.
Dave Richard is Deputy Secretary for North Carolina Medicaid.
When you've had years to prepare for this,
How do you explain that to them?
If I was the organization that wasn't getting paid, I would feel exactly as they do.
He says from the state's perspective, the transition to managed care has gone relatively smoothly overall, but tells us technical issues with provider coding in the claims process has led to the companies denying 12% of claims, a lower percentage than he says the state anticipated,
I appreciate you raising these questions for us.
but a problem nonetheless.
It's not acceptable. We're fixing it.
While providers wait, he says there are emergency advances available for those hardest hit.
If they're at that place to where they believe they can't take patients because they're not getting paid, we want to know because that's not something that's acceptable to us.
These therapists are tired of the surprises,
Every day there's something new that's coming up.
overwhelmed by the increased paperwork,
It's been pretty rough.
and left feeling abandoned.
We do not feel taken care of.
Disappointed, managed care has not lived up to its promise that patients wouldn't lose out on care and providers wouldn't lose out on payments. The executive director of the North Carolina Association of Health Plans declined an on-camera interview, but in a statement called any single issue or incident unfortunate. However, he said all involved share a commitment to make this transition work for those who deserve exceptional integrated care. Nate Morabito, WCNC Charlotte.
And to see more details about the healthcare holdup or to see other Where's the Money reports our team has done, log on to WCNC.com and click on Where's the Money. It's at the top of the homepage.